Hi, I'm Jacqueline. I'm an NP student, and I'll be doing the head-to-toe assessment on Kevin. Hi, Kevin. I'm Jackie. I'll be your NP student doing a head-to-toe assessment on you today. I'm just going to wash my hands. Okay, my hands are washed. So how would you like me to address you today?
My name's Kevin.
Okay, and what pronouns do you use?
He, him.
Okay. Are you in any pain right now?
No.
Okay, do you know where you are at the moment?
Yes, we're in the office doing an assessment.
Okay. Do you know what time it is?
It is 6 p.m.
All right, great. So patient is alert and oriented times person, place, situation, and time. Kevin, can you please remember these 3 words for me? Carpet, phone, flower. Okay? So I'm just going to do vital signs first. I'm going to be taking your blood pressure. And just so to note, Kevin does have clear speech, is well kept, well groomed. Skin is intact, no lesions or scars noted on the body. He is of normal color and of average weight for a man. Just going to be doing vitals. All right, 130 over 75. I'm just going to be assessing his respiratory rate for 15 seconds by placing my hand over his chest. Okay, noted 3 respirations in 15 seconds so far. So 3 times 4 is a respiratory rate of 12. Now we'll be doing a radial pulse assessment for 15 seconds. And I noted a heart rate of 16 beats in those 15 seconds with a heart rate of 64. So blood pressure, respirations, heart rate, and pain were assessed. Great. So now we're going to do the skin. Turgor is good. No indentation, no edema noted on the lower legs as well. Is a warm to touch. Skin is intact, no indentations, no issues there. So now we're going to move to the head. The head is of normal cephalic shape, no lesions, scars, or bumps noted. The hair is of normal distribution. The scalp has no lesions, no scars, no bumps noted as well. That's great. Face is symmetrical. Eyebrows are symmetrical, brow. Hair is of normal distribution. So Kevin, can you tell me those 3 words again?
Carpet, floor, shoe.
Okay. It was carpet, phone, flower.
Ooh.
Okay. So patient does have some sort of memory deficit, recall, clearly going on. Okay. So now we're gonna do pulses in the face. Temporal artery pulse is present +2. Maxillary sinuses are palpated, and it is non-tender. Frontal sinuses are palpated, non-tender. Maxillary sinuses are palpated and non-tender. So we're going to just do a visual acuity test right now of the eyes. So, Kevin, here is the Snellen chart. Can you please read the third line for me? Cover the right eye first. Sorry.
EPTZO.
Okay, can you cover the other eye for me and read the same line just backwards?
OZTPE.
Okay, great. So Kevin does display 20/20 vision. Looking at his eyes, lacrimal glands are intact. Sclera is white. Conjunctiva is nice and pink. Okay, eyelashes are normal distribution. The iris is intact, a blue color, and the cornea is in place. The pupils are of 2+ millimeters in diameter. Now I'm going to do the eye. I'm going to do the coronary pupil light reaction to light. So I'm going to be assessing the right eye. This pupil does react to light. This reacts to light. Non-consensual light reaction are equal on both sides. Now we're going to do accommodation. So Kevin, can you please look at my finger and follow my finger in?
Mm-hmm.
And both eyes do react to accommodation, which is great. So now we're going to be doing a whole eye test. We're going to be doing with the ophthalmoscope, looking for red reflexes. I'm just going to turn off the light.
Sure.
All right, Kevin, I'm just going to be looking on your right eye. Optic nerve is intact. I do see a red light reflex. There's no AV nicking noted, and the cone of light is intact. Same thing for the left eye. No AV nicking. Cone of light is intact. Red reflex noted. Optic disc intact. Now we're doing a test of visual fields by confrontation. So Kevin, just let me know when you see my hands.
Yep.
Okay.
Yep.
Okay. Just look straight ahead.
Yep.
Okay.
Yep.
Okay. Now, if you don't mind, just take a look. Follow my finger, okay?
Yes.
Follow it up. Okay.
Should I move my head or no?
No.
Okay.
And no nystagmus noted in that sense as well. Now we're going to be looking in the nose. Okay. So Kevin,
Yes.
can you please tell me if you can smell this? Okay,
Yeah,
so
good.
patient is able to smell and have sense of smell. looking at the nair, the nose is of symmetrical shape. The nairs are also symmetrical shape. Looking inside the nose, normal hair distribution, no redness, no drainage noted, no nodules. Patient does not have any occlusions, and I can't see the sinuses. They're not very swollen or whatnot. And patient doesn't seem to have any issues with breathing at this point. Okay, so for the mouth, we're going to be looking inside the mouth at the moment. So Kevin, can you open your mouth? So far, no lesions, no nodules or scales noted. I'm looking under the tongue. The tongue is of normal color. Everything is pink. Stick out the tongue for me and say ah. Okay. The tonsils are not visible, and it does not seem that the patient is having any issues there. So the mouth does look like to appear in a good health. Okay, now we're going to go in the ear. We're going to be doing the whisper test. So Kevin, I'm going to be standing over here, and just let me know what you hear, okay?
44.
Okay.
44.
Okay, so he's able to hear on both sides with the whisper test. Now I'm going to do the Weber and the Rhine test. So you're just going to be hearing, you're going to let me know when you stop hearing the vibration. So I'm going to be tapping this, putting it on the top of your head, and let me know if there's any differences in your hearing on either ear. And I'm going to do it again, and let me know when you don't hear this sound anymore. Okay, so I can then instruct you further.
We're gonna do it on both ears?
Yes.
Okay.
Okay, so here is the first test. Any differences with ears on either side?
No, I still hear it.
On both sides? Okay,
Yes.
great. Now we're going to do the Rhine test. Let me know when you stop hearing.
Now.
Okay. Do you still hear anything?
Yes.
Good. Now I'm doing the other side.
Now.
Okay. Do you still hear anything?
Yes.
Okay, great. So patient has good hearing bilaterally, which is great. Looking at the ears, the auricle is of good shape. There's no issues, no neck tenderness, no nodules. Skin is intact bilaterally on the ears. Now we're going to be looking and seeing if there is any tenderness on the tragus. Any tenderness here?
Sorry, I just got out of work. No.
Okay, and here?
No.
Okay, so I'm looking inside the ear again. I'm going to turn off the light. Putting the auricle up and back and looking in. So I am able to see the tympanic membrane. It is of gray and pearly color. There is a cone of light that is present, and no earwax noted as well on the left ear. Now going on to the right ear, pulling the auricle up and back. We'll be looking inside. Same with this ear, tympanic membrane is intact, not perforated. It's a gray, pearly gray color. Cone of light is able to be seen, and no cerumen, no earwax noted on this one as well.
Is gray pearly color okay?
Yes. Okay, great. So now we're going to be going on to the neck. The neck is in line, no tracheal deviation noted, no masses, no lumps or anything noted upon palpation. We'll be inspecting now for the lymph nodes. So we have the pre-auricular, post-auricular, occipital, submandibular, premandibular, submandibular, lymph nodes, supraclavicular lymph nodes, deep cervical chain lymph nodes, posterior cervical chain lymph nodes. No lymph nodes noted as well. We're going to be doing the thyroid. I'll be standing behind you, okay, Kevin, when I tell you. Just please let me know. I'll let you know when you need to swallow.
Sure.
Okay?
Okay.
So sit up for me. All right, I'm just going to be palpating your thyroid. So far, unable to feel anything. All right, Kevin, take a big swallow for me. All right, no tenderness, nodules, nothing noted there. Thyroid is intact. And looking behind here in his back, the cervical collar is in line with his body. Okay, so now we're going to be doing the chest. So Kevin, if you don't mind taking off your top for me.
Sure.
And I'm just going to be having you sit this way.
Sure.
No, like a chair.
Oh.
This,
Okay.
Okay. Maybe stand up for me.
Yeah.
Okay, sit down again. I just want them to see the back.
Okay.
Your back.
Oh. Okay.
So like this way.
Yeah. Okay.
There. Good. Okay. So looking at the shape of his back, it is symmetrically shaped. He does have some tattoos present, but no scarring, no masses, no lesions noted. Assessing A&P diameter. All right, Kevin, take a big deep breath for me. Okay, A&P diameter is good, 1 to 2. Now we'll be assessing breath sounds, okay? All right, Kevin, take a big deep breath for me. Now I'll be doing tactile fremitus. Okay, Kevin, so can you please say the word E-E-E?
E. E.
Okay.
E. E.
Wonderful. And whisper patriloquy. Kevin, can you please whisper the word 52?
52.
Whisper.
52.
So absent with whisper patriloquy, no consolidation noted. Now I'm going to percuss all fields. No consolidation noted there. I'm also, while I'm back here, going to be doing CVA tenderness. Kevin, please let me know if you have any pain when I do this. Any pain?
No.
No CVA tenderness noted there as well. Okay. Now I'll be doing diaphragmatic excursion. So Kevin, I want you to take a big, deep breath for me. Okay. Okay. Take a big, deep breath and hold it for me. All right, wonderful. Okay, So now we're going to be doing the anterior chest. So Kevin, do you mind just turning around this way? Okay, now I will be doing the same. I'm going to be palpating the chest wall and note lesions, masses, tenderness noted. Skin is intact. Now we'll be doing the same. We'll be doing percussing in all the fields. So no consolidation noted on the right or the left. And I'll be also auscultating all the fields on the front as well, okay? Big deep breath for me, okay, Kevin? Okay, clear breath sounds in all areas, posterior and anterior chest. And now we'll be doing the 4 landmarks while we're up here in our parts. We have pulmonic, the mitral, Erb's point, and aortic points, okay? I am so sorry.
That's okay.
Okay, great. So I will be auscultating first the pulmonic with the diaphragm. I'll be auscultating all 4 parts with the diaphragm, and then I'll be doing it with the bell. I will display that. Okay. Okay. Erb's point. Okay. And this is aortic. Now with the bell. Okay. Wonderful. So now we're going to be have you lean forward a little bit, and I'll be doing the mitral valve. Auscultating that with auscultating that with the diaphragm, okay? So both are audible, everything is audible, no bruits or thrills noted. No bruits or thrills noted. So now we're gonna I don't really have a bed right now, unfortunately. We do have the couch. So we're gonna transfer ourselves to the bed part of the couch. If you don't mind, Kevin, just having a seat over here.
Do you want me to keep my shirt off?
If you don't mind.
Sure.
Just arrange this better for us. Hopefully everyone can see. Hopefully everyone can see. I don't think so. That as great. I'm so sorry for all of this. Okay, wonderful. So we are going to now assess for point of maximal impulse. So I'm going to be palpating his chest for point of maximum impulse, okay? So Kevin, do you mind on your left side, like laying on your left side for me? And I'm going to just palpate, I'm sorry if you can't see, palpate here for point of maximal impulse, which is like the fifth clavicle, the midclavicular line. And it is palpable, +2. Okay, which is fantastic. And now we'll be doing, you can lay back. And now we'll be doing a vascular assessment of the upper and lower extremities of Kevin. So looking at the upper extremities, there is no cyanosis, clubbing, or edema. And looking at his lower extremities, same as well. No cyanosis, clubbing, or edema noted. Sorry, I'll be taking off his socks so we can also assess pulses.
I can get that for you.
Yes, if you don't mind, thank you. Okay. So, no cyanosis noted, or any vascular issues up on the upper extremities, and on the lower extremities, no cyanosis noted. We will be starting to look at pulses. So dorsalis pedis pulse, +2, posterior tibial pulse, +2. Then you have the femoral pulse. It's okay. I can just assess here. +2. Brachial pulse, bilaterally. +2, and then radial pulse, +2, and bounding. I'm now going to auscultate for bruits on all of these sites with my diaphragm. All right, and now going down to all right, no bruits noted in all of the vascular points. So now we'll be doing the abdomen since we are already laying down. Okay, so the abdomen does appear to be symmetrical. The skin is intact, no masses or lesions noted with that either. Upon palpation, upon shape, there is no masses or anything like that. I will be using my stethoscope one last time for bowel sounds and aortic pulsation. So first I'm going to do the abdominal aorta, make sure that I could hear it. which is audible and able to be pulsated and felt as well. Now I will be doing bowel sounds in all 4 quadrants, upper, and they are audible in all 4 quadrants, very hyperactive bowel sounds. Now we're going to percuss for tympani in all 4 quadrants. Please place your hands down. Thank you. Okay, I percussed all 4 areas of the quadrants. Now I'll be doing percussing for the liver border, assessing for dullness and tympani for the liver, and then I'll be measuring the liver diameter with my ruler. Okay. Okay, and here I will mark where I hear the dullness. Okay. Okay, and here is the other part.
Is dullness good or bad?
That just tells me like where the liver border is. A typical liver border is between 6 and 12, and yours is about 7, which is good. It's very normal. Now I'll be doing the same on the other side for the spleen. And the spleen is of normal shape as well, unable to be palpated on this side as well. And now we're going to palpate our inguinal nodes. If you don't mind, I'm going to be assessing them.
Can I really take this off? Just from my
I can drape you, yes, if you don't mind.
You could just, that's fine.
I can just drape you.
Okay.
Okay, if you don't mind taking it off, just to
Sure.
have.
Can I leave my underwear on?
We can just pause, and then I can put the. And now we'll be assessing for the inguinal nodes. We drape the patient appropriately, and I'll be assessing the inguinal nodes here and here. And they are not palpable, no tenderness noted there as well. Okay, now that Kevin is properly dressed, we'll be doing range of motion. So we'll be doing range of motion of the arms. So Kevin, can you just move your arms like this? Okay, and your wrists and your shoulders. Okay, good range of motion of that. We're gonna just palpate the shoulders and the elbows, the wrists, the joints of his fingers. No nodules, no joint stiffness noted, no tenderness noted there on both arms. Okay, and good range of motion as well. Now for his lower legs, we'll be doing lift up the right leg, good, and the left leg, good. And for your ankles and your toes, can you just move them for me? Okay, great. So we're going to be doing the cranial nerves now that Kevin is seated. Cranial nerve 1 is the olfactory that we did earlier with Kevin smelling and able to take note of the smell of the candle. Cranial nerve 2 is the optic nerve. Kevin was able to do that by doing the visual acuity test with the Snellen chart. Cranial nerve 3, 4, and 5 are 3, 4, and 6. I'm sorry. Those nerves are the were performed by doing the lateral test of the eye and kind of following my finger. Cranial nerve 5 is sensory and motor tegmental. So this one we can do with Kevin kind of biting down in his jaw. Good job. And then the jaw side to side like this. Okay, good. Wonderful. Also with the facial, which is cranial nerve 7. This one, what we can do is, please, I'm going to have Kevin kind of resist my hands. I'm going to close his eyes and he's going to try and open his eyes, okay? So try and open your eyes for me. Okay, good. So he does have that reflex for him as well. For the cranial nerve 8 is the acoustic. We did that earlier with the rubber and rind test for Kevin. And same thing for glossopharyngeal and vagus nerve. We were able to do that by swallowing like we did earlier and making sure what we did for the thyroid. Now for the spinal accessory for cranial nerve 10, we'll have Kevin shrug his shoulders and try to resist gravity. So try shrug your shoulders for me, Kevin, and try and resist, and he's doing that pretty well. And also cranial nerve 12 is the hypoglossal, and that again is stick your tongue out and wave side to side, which is great. So Kevin did really well with that. Now we're gonna move to our motor function. So Kevin, can you please put your hands out like this and close your eyes? No upper extremity drift noted. And also I'm going to just kind of resist. So keep your hands up. You can open your eyes now, and I just want to see your strength in your muscles. I'm just going to try and resist and try and resist. Okay, good. Same thing for our legs. Put your legs out for me and try and resist. Good, and up. Can you see? I don't know if you can see. Try and resist. Up. Okay, good, and up. All right, great. Other leg. Try and resist. Okay, good. Beautiful. So he does have good strength. Now look side to side for me and try and resist try and look this way. Good. And try and look that other way. Good. So he has very good neck strength as well. Now we're going to be doing sensory, just for pain and light touch. So for pain, I'm going to be using my nifty tool and having Kevin let me know if he feels pain on the areas I'm touching him. Okay? Let me know if you feel pain. Yes?
No pain.
Do you have any sensations everywhere? It's equal?
Everywhere.
Okay.
Yeah, it feels the same on both sides.
Sharp, dull. So I'm going to do sharp and dull. Okay?
Okay.
Tell me if you feel sharp.
Sharp.
Okay. Do you feel this?
Feels dull.
Okay, good. How about here?
Feels dull.
Okay, how about now?
Also dull.
Okay, so it should feel sharp. Do you feel sharp?
Now it feels sharp.
Okay, that just broke. So yes, wonderful. We were able to do that pretty well. So now we're going to assess balance and coordination. So Kevin, do you mind just standing up for me?
Sure.
We're going to do heel to toe gait.
Okay.
Walking that way.
Walk this way.
So just walk with your heel and toe in front of each other. Okay, now on the way back, walk on your toes. And then walk on your heels. That way.
Okay. Heels?
Okay, good. And now we're going to stand right there. We're going to do a heel to shin down exam. So you're able to do that for me? So all this looks very good. He's not exhibiting no issues with coordination or balance as well. And now we're going to be just have a seat here.
Okay.
And we'll be doing the finger to nose test. So Kevin, do you mind just being able to put your finger to your nose? Okay. Other side too. Okay, good. Wonderful. Okay, wonderful. So now we're doing deep tendon reflexes. So I'll be using my trusty tool to do that. So I'll be doing the reflexes, deep tendon reflexes. First, we'll be doing the brachial bilaterally, which is reactive. The brachial radial. We'll be doing the quads. So sit up for me. And the Achilles, which is down here. And it'll be doing the plantar, which is under the bottom of the foot. Which is a Babinski reflex, okay? Okay, and that is positive. So that completes our head to toe assessment. Thank you.